Number 7, Grant Robertson.
Thank you very much, Mr Speaker. My question is to the Minister of Health. Is it correct that there is a $156 million gap between the amount the Ministry of Health has advised was necessary to meet population and demographic growth in Vote Health for 2011-12 and the amount of new spending allocated for Vote Health in the 2011 budget?
The Honourable Tony Ryall.
Mr Speaker, it is correct, as the Ministry of Health advised, that to meet cost and demographic pressure, the health vote would need $576 million available. As my budget press statement of the 19th of May said, that I've made it clear at every opportunity, funding of $855 million was made available, which was made up of $420 million of new money and $165 million of reprioritised, unallocated and unspent money.
Speaker. Point of order, the Honourable Trevor Mallard.
Mr Speaker, I think we've taken your advice very carefully about the framing of questions which are straightforward and ask for a specific answer. Sir, we know that normally you don't insist on a yes or no answer. In this particular case, I cannot tell from the answer that the Minister gave whether he was affirming what was said here or denying it. Sir, and I'm not sure what we can do.
Order. The member's better than that. I think the Minister, and the Minister must correct me if I'm wrong here, but what I heard the Minister say was the answer was essentially yes. And if I'm wrong on that, the Minister better correct it. Grant Robertson.
In light of that answer, why did he then state in his media release dated the 19th of May that, quote, an additional $585 million had been allocated for Vote Health, when in fact $165 million of that was not additional funding, but rather recycled money from the rest of the health budget?
The Honourable Tony Ryall.
Mr Speaker, because that money is available for new initiatives. I can't understand the issue. It's quite clearly set out in the press statement of the 19th of May.
Dr Paul Hutchison.
Thank you, Mr Speaker, to the Minister of Health. What has been the total amount of new resource that has been invested in Vote Health over the last 3 years?
The Honourable Tony Ryall.
Mr Speaker, despite the world's worst economic recession in 70 years and the enormous effects of the Christchurch earthquakes, this government has invested over $1.5 billion of new money into health. This has been part of the reason why the government has been able to lift elective surgery to record levels, speed up access to cancer treatment, reduce waiting times at emergency departments, and lift immunisation rates for 2-year-olds to record levels.
Grant Robertson.
Mr Speaker, what reasons does he have to disagree with the Whanganui DHB Chair Kate Joblin when she told the Whanganui Chronicle after the budget, quote, we will receive a small increase of funding over the previous year, but this is unlikely to keep pace with inflation?
The Honourable Tony Ryall.
Mr Speaker, I haven't seen that quote, but what I do know is that in the last 3 budgets, the Whanganui District Health Board has increased its funding by $20 million, and they are providing more elective surgery, better treatment for their patients, better immunisation, and delivering results for the people of Whanganui.
Grant Robertson.
What specific programs will be discontinued as a result of the reduction in funding of $38.1 million for public health purchasing announced in the budget?
The Honourable Tony Ryall.
Mr Speaker, with respect to the public health $38 million, there's more than half of that savings comes from water subsidy decisions announced earlier this year, but there have been savings, wait for this, there have been savings in advertising, from the merger of the Auckland City Councils, from shifting vaccine procurement to Pharmac, and from the low uptake of some vaccines. We are on track to spend $449 million on public health this year, and we're budgeting to spend $453 million on public health next year.
Question number 8, Kevin Haig.
Thank you, Mr Speaker.